Senator, President Trump is aggressively advocating hydroxychloroquine, an anti-malaria drug, yet Dr. Fauci has repeatedly warned that there is no real conclusive evidence to support using the drug for coronavirus. Why do you think he is pushing that drug so hard? I mean, does he have information that we haven't been provided?
Sonny, your guess is as good as mine. I have no idea, but what I do know is this. It is a drug that has been proven to give relief from pain and almost disability to people with rheumatoid arthritis, people with lupus. And right now, I'm hearing all over the place that people are hoarding this drug in a way that those who need it to relieve their pain and extend the quality of their life may not be able to get it, all because the president keeps taking the stage. And as opposed to what Dr. Fauci and medical health professionals are telling us, pushing this drug. He's got to stop. We don't want a drug pusher for president. We want somebody who takes that stage and speaks to the crisis in a way that is about bringing relief. I mean, one of the things that I've been focused on, from my years of being Attorney General, is consumer protection. 10 million people as of last week, and just over the course of the last few weeks, lost their jobs. 10 million people. One of the things I'm focused on, and I'm proud to announce it on your show is I'm calling for a suspension of credit card interest, fees, and penalties. Because right now, there are people who are out of a job, who did not plan for this moment, and are going to be buying groceries with their credit cards. And those exorbitant fees that people are charged anyway, they should be suspended during the course of this pandemic. So I'm calling on a suspension of credit card fees and penalties and interest rate for the next 120 days, because people are not going to pay their bills on time. A lot of folks just are not. And at the end of this pandemic, it's going to be awful for them to be trying to get back on their feet, find a job, get back to that small business they were working for, and deal with these exorbitant fees. The other thing I'm calling on is to say that we should suspend negative reporting to credit scores. Because the other thing that's going to happen, again, people are not going to pay their bills on time. And then it's going to go on their credit score. It takes a lifetime for people to clean up their credit scores. And folks should be able to have as much as possible to get back on their feet after this pandemic. So that's the kind of leadership we need. Speak to the issues that are affecting people right now and try and find relief for folks based on the authority of your office. But I don't know what this guy is doing.
Senator Harris, this is Megan again. I think that's a very patriotic and noble idea, and I hope that bill gets passed, because you're right. How can we expect people to pay their bills when they're incapable of working? On a totally separate note, I want to ask you about something that's really, I think, disgusting and very hard for the American public to watch, and that is the absolute disproportionate impact that the coronavirus is having on African Americans.
Yeah.
In Louisiana, 70%, this is insane, of the deaths are African American people. We are seeing similar racial patterns in other states here in New York City. What should we do? Why do you think we are seeing this disparity? And if we don't do something about the inequality, will this country be able to recover? One of the options we thought on this show was maybe FEMA needs to start sending in extra medical care and extra medical tents into some of these cities and areas of the country that is being hit so hard.
Thanks for bringing that up, Megan. So the fact is that during a crisis, it magnifies the disparities that existed before the crisis. And in a crisis, people who are doing bad do even worse. And so on your point about racial disparities, we know that African Americans and children are 20% more likely to have asthma. The African Americans are 40% more likely to have high blood pressure. Black women are 3 times more likely than white women to have lupus, which we just discussed. Sickle cell anemia, one of the things that threatens anyone who is living with sickle cell anemia is a respiratory virus. So those who had pre-existing health conditions based on racial disparities, based on socioeconomic disparities, are doing even worse in the midst of this pandemic. And so it requires us to address it in a way that also recognizes the historical nature of it. For years, I've been working on Black maternal mortality, which before this pandemic was very real. We were talking about it. Black women are 3 to 4 times more likely to die in connection with childbirth than other women. And when we looked at the issue, it had nothing to do with that woman's education level or her socioeconomic level. It literally had to do with the fact that when a black woman was walking into a hospital or a clinic or a doctor's office, she was not being taken seriously. So these are issues that have to be addressed, and you pointed to one solution, which is about FEMA directing resources to those communities that we know had disparities before this pandemic, and those disparities are going to be exacerbated by this pandemic.